Thank you, and good afternoon, everybody. I hope you had a nice weekend. As we begin the last week of April, I want you to know that leaders from government, healthcare, and business throughout the region are all working together, and we all share that sense of urgency. We know the importance of bringing more of our economy back online while protecting against a second wave, stopping new infections, and saving more lives. We won't do any of these important things well unless we balance the need to do all of them well. If we rush to reopen without important safeguards, including testing and contact tracing, the virus will spread and hit us harder than it has so far. However, we also know that the impact of this economic crisis is devastating as well, and we must move smartly and safely in the weeks ahead to bring more of the economy back online. So, balance and a thoughtful, coordinated approach across our region will be key to this complicated challenge. And that's why I am so grateful to the leadership shown by our area government, business, and healthcare leaders. I think we all have to remember that this is a once-in-a-century pandemic. Nobody has the exact right answer, which is what makes all of this such a wicked problem. Everyone is working to achieve what's best for the people of the region, and we need each of their perspectives in order to do it well. Now let's take a look at the data. So as you know, our modeling showed that the initial crest of hospitalizations would hit us over this past weekend. But also, as you've heard me say before, the virus really dictates when the crest is, not the model. We will have to analyze the data in the coming weeks to see if the crest begins to come down, and we're hopeful that it will. And if it follows our projections, it should. The numbers will continue to fluctuate day to day, and that's okay. It's the trend over time that truly lets us know what's going on. Importantly, while our region's healthcare systems are experiencing stress during the pandemic, they have not been overwhelmed. That is because of the hard work that everyone has done to stop the spread. Our numbers today are fairly consistent with where they have been in recent days. We currently have 690 people hospitalized, which is up from yesterday when we had 652. Again, this number will fluctuate daily, but we need to keep our eye on the trend over time. There are 152 intensive care unit patients, which is down from 162 yesterday. And we have 109 patients on ventilators, which is down compared to 115 that we had on Sunday. And now for the good news. Another 15 COVID patients were discharged yesterday to bring us to a total of 1,117 patients who have been discharged from our hospitals since the first confirmed positive COVID patient. The number of patients in the hospitals still remains high compared to the numbers from early April. Today, despite all of the great progress we have made in the region, we're still nearly 50% more patients in the hospital because of this virus than we were on April 5th. But because of everyone's determination and sacrifice, we have kept that percentage from rising even higher. But we must continue to drive down our infection rate in the weeks ahead. And we hope that the hospitalization rate will start to decline as well. As we move forward, I'll continue to share with you our daily numbers, and we'll also keep you updated as we begin to see trends in the days ahead. And with that, I'd be happy to answer questions from the media.
Dr. Garza, one reporter writes that it has been a recently held theory that pathogens like the coronavirus may attach themselves to air pollutants or even dust particles in the atmosphere, potentially allowing them to remain suspended in the air for distances higher than 6 feet, and maybe even allowing them to travel many miles in the air or on the wind. The reporter indicates that the plague was able to transmit via dust particles. Does this suppose another threat consideration for people trying to protect themselves from COVID-19?
Theoretically, that I believe is true. However, there are a lot of other factors that go into how fast and at what concentration virus particles can travel. And a lot of that has to do with wind currents, humidity, any of a number of things. So there have been studies that have shown it can travel more than 6 feet, but I think the question then is all of those other factors plus how much of the virus is going to be traveling as well. So certainly you have to have a large enough dose in order to increase that probability of infection. So it isn't just that it can travel that far. There's other things that have to be thought of when you're thinking about, is this a risk or not?
A follow-up question from the same reporter.
Mm-hmm.
The CDC is saying that UV light, particularly the sun, can kill the virus effectively.
Mm-hmm.
How does this differ, or does it differ, when the virus is in the air versus on surfaces?
Theoretically, it shouldn't matter if it's in the air on the surfaces. So, I would have to specifically go back and look, but theoretically, it shouldn't matter.
Another question, have we hit the peak yet as predicted? And if not, when will the peak be reached?
The numbers have remained fairly consistent over the past couple of days. And so really when we talk about the peak or the crest of the hill, we're going to have a little bit more data on the backside so that we can then understand this is where we believe we saw the absolute most number of hospitalizations. And so, like I said, we don't concern ourselves as much with the day-to-day variability. It's really that trend over time. And then we'll work backwards to see when was the actual crest of patients.
One that just came in during the briefing from a reporter, studies are now showing that people with hypertension are more likely to have poor clinical outcomes if they contract the virus. Mm-hmm. Hypertension is both more common and more destructive in African Americans than in other ethnic groups. Some immunologists are calling for the country and or states to provide free hypertension medication and screenings for everyone who needs it. They believe that within 6 weeks of taking the medication, these individuals could be less likely to die from coronavirus complications. What are your thoughts on that?
So certainly patients, we know that patients with chronic conditions such as hypertension, diabetes, lung disease are all at higher risk for morbidity and mortality from the coronavirus. And so, treating hypertension doesn't just stop with treating the effects of coronavirus. It also decreases your risk of heart attack and stroke and renal failure. And so anything that you can do to decrease hypertension is good, not just for infectious disease purposes, but across the spectrum of clinical problems. So, anything that we can do to support bringing hypertension down is a good thing.
Can you describe if there has been any push from local business leaders to ease social distancing restrictions in the St. Louis area? If so, how have you responded to those calls?
There have been a lot of discussions amongst business leaders, government leaders, healthcare leaders about how fast and how much can we open up the economy. And part of it is about social distancing rules. Clearly, we recognize that there has to be a balance between the public health needs as well as business and economy needs for what our objectives are. And so the question then is balancing how much transmission can we limit within the community while opening up the economy for everyone else. I will say that the economy is going to look different when it comes back online, and there will need to be accommodations for social distancing measures, much like you've seen at the grocery store and other places that have remained open during the pandemic. It looks much different. And those techniques to decrease transmission are going to have to be incorporated into everybody's business, at least for the foreseeable future, until we develop immunity in the population or a vaccine becomes available. The virus doesn't go away, so it's up to us to develop policies and procedures on how to limit transmission.
Have you had a chance to review Governor Parsons' plan to reopen the state set to be released today? What is your response to the measures laid out in the plan?
I know the governor released his plan, I think just maybe 20 minutes before we came downstairs to do to do this program, and so I haven't looked at it in detail. In general, though, a lot of the things that the governor has advocated, I think, are the appropriate things, like which is more testing and contact tracing, more personal protective equipment, and the ability for the healthcare sector to be able to effectively take care of COVID patients. And so those are all very, effective measures for reopening the economy.
For how much longer should this shutdown of businesses go? Because this reporter writes that he's starting to see and hear that there's no way to beat the virus until there's a vaccine.
Technically, there is no way to beat the virus until you get vaccine. So if you think about what is this going to look like at the end of it all, it is immunity in the population, much like we do for measles and for mumps and for everything else. The way that you defeat those pathogens is to have immunity in the population. Now, the key is how much can you then decrease the transmission while opening up the economy. Because you don't want to open too fast, then it's too many people that are going to get infected, and then too many people in the hospital, and then you have an increase in the number of deaths. So it's this delicate dance that we do to make sure that we're balancing the public health goals with the economic goals as well. And there's no one size fits all. And if anybody tells you they have the perfect plan, they're probably lying to you. So it's a delicate dance that we do.
Thank you. That concludes the list of questions received from members of the media prior to and during the briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.